The Law Reform Commission in Hong Kong in 2006 first proposed a model form of an advance directive for Hong Kong. And that form is actually available on the internet. The requirements is that the patient is mentally sound and that the document has to be witnessed and signed by two people, one of whom must be a physician in Hong Kong, and the other can be any adult who does not have any interest in the patient's estate. So in the form under hospital authority, they added an additional category, which is other end-stage irreversible life-limiting condition. So that would include end-stage COPD, end-stage heart failure, end-stage kidney disease, or end-stage dementia. Under hospital authority, if you want to have an advance directive completed, you would need to be somebody who already falls under one of these conditions, who have an advanced illness. If you are a healthy adult and you're interested, they would usually advise that you go out to the private system to identify a doctor who's able to help in completing the form. So if you are in the private system, I would recommend first that you look up the Hospital Authority Advance Directive form that's easily searchable on the internet. You can also look at some advance directive forms in other countries, but be mindful that the legal requirements for advance directive in other countries differs in Hong Kong. So if you use their forms, it may not be valid in Hong Kong, but using it as a reference. After you're familiar with the form and you would like to proceed with completing an advance directive form, then it would be important to then identify a doctor who does provide that service. I think the doctors who tend to have familiarity and the comfort level to fill out these forms, and more importantly, to engage in advanced care planning conversations, are typically doctors who are palliative care specialists or geriatricians. The forms would allow the patient to specify specific life-sustaining treatments that they would want withheld under those conditions that are specified. So the life-sustaining treatments, the most common one is cardiopulmonary resuscitation or CPR. Sometimes some patients may specify other treatments, such as withholding feeding tubes, withholding mechanical ventilator, withholding dialysis, for example.